Hello everybody, my name is Hassan Doumbia. I'm going to talk about IGC 1, element 3. In element 3, we are going to talk about health and safety management system, what they do. The last topic I spoke about health and safety management, the planning, what safety management they are planning. Now is what they do, right? The responsibility. Let me proceed. Organization roles and responsibility. What are the organization roles and responsibility? Everyone working in an organization will have practical responsibility for their health and safety and that of another. The ILO, which is the ILO Convention in 1981, then Convention C155, right, and recommendation in R164 place a specific duty and respect of health and safety to different people within the organization. So basically this means that these organizations, the ILO is there, they put a regulations, a convention in 1981 which stipulates that these are the labor laws that every country they should follow, right? So they put this law. Then now in that laws, we are talking about that those laws, they are the responsibility, the roles and responsibility of those laws, right? First of all, we're talking about the directors and the senior managers, right? So directors and senior managers of every companies or organizations or countries, right, must demonstrate clearly their commitment and leadership with regard to health and safety and have a strategic responsibility to ensure. So this simply means that the directors, they are in the strategic department. Strategic means the higher level. They make the law, right? So they make the laws, and they also they pass the law to the tactical. The tactical also they put the laws together in operational level. Then they pass it to the operational. The operational is the last level, people that work in the field, right? So we continue to speak about directors and senior managers, right? Must demonstrate clearly their commitment and leadership with regard to the health and safety and have the strategic responsibility to ensure. What are their strategic responsibilities, the directors? Number one, the right health and safety policy is in place, right? So they make sure that the right health safety policies, they are in place for every staffs or peoples. It depends who are working in their facilities. Then number two, there is an adequate budget for implementation of the policy. So they'll make sure that there is sufficient money or sufficient fund to execute these projects or policies of health and safety in terms of everybody undergoes the medicals, and these are the medical tests you should go and how to prevent their staff. So there should be adequate fund. Then number three, their responsibility also the rights of the organizational structures are in place. They make sure that all organizational structures, like the facilities or where people are working, they should be in good order, in place, right? Then number four, the competent peoples are employed by this organization. So they put it in their laws that the competent people should also give the job. Who is due for that job, who is eligible for that job is the people they're supposed to give, right? So we're talking about demonstrating the top management commitment, right? So the top management, you have the top management. Top management are directors, senior managers. They demonstrate their commitment to health and safety through the strategic thinking by one, They ensure the availability of resources. They make sure that all resources are in place when they are executing these health and safety measures. Then number 2, they define the roles and responsibility of everyone, or the reason why they are doing these safety measures, the reason why people should follow this safety, whether it's fire safety, where is health safety, where is like protecting company trademark. So all these things should be in place. Then also appointing a members of top management with specific responsibility for health and safety, right? Then also appointing one or more competent person and adequate resources to provide assistance. Then also they review the performance at the board level. They review every performance. This year, this is what we are going to, same like auditing, right? After they have auditing, they read the performance of every people. This time and this time we don't spend on this amount of medical, we spend this amount of medical. These are the people that are eligible, that are fit. And then our company is still on the profits basis, right? So that is review. They review the performance of everybody. Then also directors and senior managers have the enormous influence over their organization and its priority. They must demonstrate clearly the commitment and the leadership with regard to health and safety. So like the director also, they should monitor things like their teams, which like the operational or the tactical team, like the managers, safety managers or incident manager or other management, that this month or this year, what is your review, what is your report, right? Then also the director also, the influence of visible management and commitment and leadership on safety culture is discussed later in these elements, right? So in we are going to discuss later about the influence of this management, the commitment or the leadership that these directors they should have, right? Then after I finished speaking about the management, the top management, now I'm going to talk about the middle management, which might call the tactical management in the safety, right? So this middle management and supervisor, these are responsible for the health and safety within the organization. They control, for example, what is their responsibility? They control what? Number 1, they control health and safety policies are implemented and monitored. So they are there to supervise that people are following these rules and regulations, people are using the right way, people are using the way where vehicles are using. So they are there to execute the duty, to follow the policies that these top management, like the directors, they put into policies or records that every people in this organization should follow these rules and regulations. For example, if they say people should wear their PPE, that is personal protective equipment. So this middle management, they are there to supervise, to monitor, to help where there is a ratifications. They also speak to the top to the strategic management that this is what we're facing, and this is you need to do this ratification, you need to do these revisions, right? Then number 2, safety system of workers and equipment are supplied. So this middle management makes sure that all safety equipment or whatever tools these lower management they need, they should provide this one. Then number 3, the middle management makes sure that incidents are recorded and investigated, right? That is number 3. They should make sure that these incidents are recorded and review and investigate. So we're talking about the middle management also. They are responsible for what? The staff, number 1, the staff that work directly for them, right? They're responsible for the staff that are working directly for them, their direct reports. Then also the staffs below down in the organization charts, right? They work for them. Then also the areas and activities under their control. So that is the facilities, the place or the environment which is under the middle management, under their control. They supervise this area, that what is going on in our facility, why people are using this way, why this place is not blocked, why people are using this access way, why there is no safety sign in this place. So the top management are there to supervise, right? Then after the responsibility, so like you have, they are responsible for these categories of people and facility. Then also we're talking about the safety specialist. Who is the safety specialist, right? So typical responsibility include they provide advice, that the middle class, they provide advice on the legislative requirements. So legislative requirements means that the laws, they provide that the field work is also different a little bit from the normal policies. So sometimes in field work, because of the environment, it can affect the policies. So these middle class, they advise on this legislation, and this law is not applicable here, or you need to add these things in this law, in this policy, or because of the weather, there is too much weather, hot, so people are prone or exposed to danger where they are working, so they need to amend the laws of medical. So they are there also to help and to give suggestion, right? So the safety specialists also, they develop that the middle class, they develop and implementation policies, right? Then also they oversee the implementation of adequate risk assessment. So they oversee and take record of this risk assessment, whatever things is on risk, that is the middle management. Then they also identify training needs, right? So they also identify training needs. If people need training, they are observing the middle class, that the middle class are observing their subordinates, their staffs, which are not following the policies or any mistakes, or if people need training, they are not doing their work properly, or they are doing their work properly, they need added advantage to their work, they need added training. So they will suggest to the top management that these people, they need to go undergo this starting training to also help them in their careers, right? So these are the responsibilities of the middle management. So I spoke about the safeties. Then another one also, they need to monitor the health and safety performance. So in monitoring their staff's health and safety performance, and also things that will also destroy their health, their livelihood, and when they are taking their meals, that's why you see they have lunch, they have breakfast, they have lunch, then they have dinner. So they also try to bring this facility, that this time is for lunch, this time is for this period. Then they try to bring water facility, all of these things to keep the staff health running, right? These are safety measures also. Which one have medical conditions, they will bring insurance, and also help in doctors, right? A doctor also give them leave so that they can get proper treatment also, right? Then also I'm speaking now about the responsibilities of other personnel. So when we talk about the responsibility of other personnel, like the workers are expected to act responsibly and take a reasonable care of themselves and of others who may be affected by their action or omission, and also to coordinate with their employer in respect of their health and safety. Then I'm going further to talk about person in control of the premises. So person in control of these premises are required to ensure that the premises and the means of access to ingress from them are safe and well manned, right? So like the securities of this area, or the watchmen, this is their responsibility. They should make sure that people that are accessing this facility should be checked, or the people that have authorization to come to these premises, like if it's a office, or if it's a resident, or if it's a governmental company, it depends. So the security, this is his responsibility. That's why company need to employ security. So in this part, this is responsibility of the security to watch, right? But the middle management are there to select that we need security teams. Then I'm going further to explain about self-employment. Self-employed person must ensure their own health and safety and that of another who might be affected by their business or undertaking. So self-employment, they must make sure that their own health and safety and that of the other people who might be affected by their business or undertaking. Then I'm going to talk about general duties of suppliers or manufacturer or designer. So general duty of some of these suppliers or manufacturers, all person designing, manufacturing or supplying article which include plants, equipment and natural or artificial substance for the use by other in the course of their work or bounds to ensure so far as a reasonable practicable that these are safe and without health risks at the time when using or maintained, right? So these are the general duties of suppliers who are coming to any facility to supply, that is outsourced also. Then now, in this other topic, we're talking about clients and contractor, their relationship. Client and contractor. Client simply means that if you are working for someone, right, someone give you a service to render, so the person is called the client. Same like customers. Then for you are contractors, right? You are the one who is working for them. You are contractors or staffs. Clients can be the employer, right? Let's simplify it. So in this context, contractor is a person or an organization engaged to undertake certain work on behalf of the client, but not under the client's direct supervision or control. So this simply means that contractors, the clients give the contractors the contract, right? So when the clients give the contractors the contract, the contractor will do the work that the client wants him to do, but the client is not the one to supervise this contractor. The contractors will have their own boss, their own team, who is going to supervise that responsibilities of their staffs that they employ, the contractors. Then who is a client? A client is a person or organization who engage a contractor. So it simply means that they engage the contractor after they are the one giving contract, and they will engage the contractors. So we go forward to talk about the sharing duty.